Well, I'm dealing with chronic kidney disease, and I went to my nephrologist last week. He said that I'm operating at 1/3 of my kidney ability. That is, that my kidney is damaged.
Yes.
Both kidneys. A innumerable number of stones was reported by my urologist, and it got me kind of scared. But I want to deal with it. Of course, I don't want to just sit and worry about it forever. So, I'm trying to make sure that I embrace the SOS diet, which is no sugar, no processed seed oil, and no salt. And so, what else could I do to kind of, preserve the function of my kidneys that I have left?
You want to make sure you got good levels of polyphenols, such as resveratrol, quercetin, ficitin, those sorts of things. The kidneys are basically big bunches of very, very tiny interlocked blood vessels. That's where the exchange of, just as the lungs, the exchanges of gases, and the kidneys, it's the exchange of proteins and electrolytes. It's there to keep our sodium, potassium, calcium, and chloride, all of these things in a good range, even though we are flooding ourselves with, hypo electrolyte fluids like water on a regular basis. And so when kidneys are going bad, what you need to think of is it says your blood vessels are going bad, the small vessels, because that's what they are, big bundles of very, very fine vessels that are doing this electrolyte exchange for us. And so things that improve vascular health, like the resveratrol and so on, those are things that we want to shoot for. I also see some biohackers claiming that their renal function has improved on rapamycin. I don't know if those claims are valid or not, because I've never seen a particular formal study in which they did a series of renal function studies on a large group of people, half on, half off the rapamycin. But it is one of those areas that we are being told in the kind of informal networks that some folks are seeing improvement in their kidney parameters.
What's your thought about vitamin K2 and D3?
Well, I think that the combination of D3 with K2 does a better job than either alone. They seem to be synergistic. They help each other work and do a better job. And, on the one hand, way up here in the Pacific Northwest, where we don't get a lot of sunshine, and where people hide from the sun when it does come out, you'll see that on a sunny day, everybody's walking in the shade and wearing their hat. We get a fair bit of toxicity from people who take too much vitamin D3. If you get those blood levels up over about 125 or so, you can start getting kidney damage from your vitamin D. And so that's one of the reasons we check our patients' vitamin D at least twice every year. We check it every spring, we check it every fall, to make sure that we are in a nice, robust, but not toxic range. And the K2 helps to protect you against the toxicity of very high doses of vitamin D.